So, welcome today, and today we are going to cover the concepts of diabetes and obesity, and we'll keep bringing that back into COVID, because COVID-19, of course, it's a much bigger risk factor, perhaps even tenfold risk factor increase, if those are major issues within your own health journey. And the other useful piece, I think, so diabetes, well, that's pretty common. Lots of people talk about it now. But the other piece, obesity, that's a challenge to be political correct. We've often created the idea in society that this is a personal failing of people, and that's not appropriate. There's a lot to it. I'm even willing today to give a few suggestions as to why it's become such a huge problem here especially in North America, but also in other parts of the world. I mean, quite a huge problem even in the UK, which has had a real problem with COVID-19 deaths. But unfortunately, half the men over 70 are obese, and so that makes a very major risk factor. So we'll try and talk about those things in practical terms. There's no magic weight, and weight is less important than the girth or belt size that we're wearing. I don't mean a belt that's all cinched up, or as guys do sometimes, they do all their belt work underneath their pot belly. That really doesn't help. What we're trying to do is get the measurement around. And the girth, people would like to have you under 38 inches. And I think it's probably fairly similar for women. Once you get above that 38 inches, and I apologize, it's around just under 100, so call it 95 centimeters ballpark, if you're into centimeter measurement. So let's tease part of those issues apart in the beginning so that we're working from the same page. I think everybody can agree that it's a very common problem. There's most of the states in the US have quite an obesity crisis, and much of Canada does too. I'm sorry, this is Kristina Mitts, my colleague, and she's a therapist, works with us with regard to expertise in nutrition and the microbiome. I'm of course did some initial family practice, and I did anesthesiology and intensive care and research in how the brain works. And then since then, after an academic spot, I've been out on the coast, and then because of MS, left that over 20 years ago to leave the operating room and now do small amount of integrated medicine practice. And I write books, and of course one of the premises we'd like you to use is solving the brain puzzle, because that will give you many of the issues that we talk about. Not all of them. The ones that we don't talk about a lot within that book, they will be put on my website, drbillco.com. So that gives you a place to go. Kristina's done a great job of researching those pieces and learning about how they can all fit together and how you could use them in conjunction with the book. Because every time we talk about brain health, we're in many cases talking about the same thing for gut health, and even the issue of diabetes and obesity, okay? People that are obese have much more risk of brain problems. People that are obese have much more risk of diabetes type 2. So if we break those down, in fact, even Alzheimer's, a major brain problem that lots of us are at risk for over time, has been nicknamed diabetes type 3, okay? So if you tease all those pieces apart, anything we do today and talk about will be very valuable for your brain health, but also your long-term well-being. I mentioned, I think last time, a pound of fat has 8 miles of blood vessels in it, okay? So you can see how that might relate very quickly to issues of hypertension, because the heart's got to work much harder to pipe it through all those. And much hypertension or high blood pressure is called essential. That means we don't have a specific trigger cause. And I would suggest one of the biggest causes is the brain is short of blood flow and short of oxygen as a consequence. So it tells the heart, raise the pressure so we can increase the flow. And you can do that to some degree, but secondarily you end up with hypertension. So to move on from there, when we talk about obesity, the big thing I want you to think about is belly girth, all right? Because it's the fat in around our intestines that give us that belly girth, and that is the fat that becomes its own endocrine organ, okay? By becoming an endocrine organ, it's a really important part of our life and problems.
It drives how our immune system behaves. So it actually does contain all of these immune cells. So the way that this relates to the coronavirus is that these immune cells that are present in certain types of adipose tissue will drive the cytokine storm or drive the inflammation that is going to make you more susceptible to having issues if you do end up coming into contact with coronavirus.
That's right. And the other piece, of course, is that own endocrine organ, the fat tissue in around your intestines, creates its own inflammation molecules or cytokines. Okay, so those are chronically elevated. And that's the same group, but a slightly similar group anyway, that are raised if you have blood sugar raised. Every time you get a blood sugar spike, you get a secondary insulin spike, and all of a sudden you get an inflammation spike. So the better you can control both of those parameters, the lower will be your baseline inflammation. And chronic elevated inflammation, very hard on your blood vessels, so your heart and your brain, very hard on your peripheral circulation, so maybe peripheral neuropathy from the diabetes, but also lack of optimal healing potential and a stress on the immune system. Anytime the immune system is stressed inordinately, and unfortunately fear is one of the stressors that is troubling me a lot these days. We lock down people at home, they get fearful of the virus, and all of a sudden they spiral into a more challenging issue with their immune system. So knowledge is power. And I would suggest in 2 to 4 weeks, you could make a significant difference whether you're faced with obesity or the edge of diabetes or just controlling your diabetes. And primarily when we're talking about diabetes today, we're going to be talking about type 2, which quite frankly is a diet and lifestyle illness. And if you can shift into more exercise and better diet, I think we were talking a little bit about this. I mean, if we could get people to take a spin at gluten-free, casein-free, we may, because in a third of people that really dials up their inflammation. And if we can dial down their inflammation, they may start to feel better, less stiff, less sore, more able to walk or exercise or some variation thereof, and all of a sudden they can start to win. And you in 2 to 4 weeks could start to make a difference to your risk of the downside of potential COVID-19 infection.
Exactly.
So if we start with those premises, and we would like to get you under a 38-inch waist, mine was 32 in high school. I haven't got back there. Maybe I did once for a little while. I dropped, 2 to 4 inches when I quit gluten. And so that's a big clue. I mean, there's a reason, I think it was William Davis wrote The Wheat Belly. Okay. I mean, the wheat belly is the real deal. So that's a cardiologist in Wisconsin. He wrote a really good book because he explained that people could often get their love handles to disappear once they went off gluten. And as a consequence, if you can do that, all of a sudden their diabetes went away. Even his borderline diabetes went away. So there's no question that seeing is believing. It made a big difference for me. I had a brother that was up to 430 pounds. He gave up gluten. He got down to 350. I think I mentioned this before, because he's the one that eats every gluten-free snack known to man. So he hasn't got much below 350, but that alone was a huge assist in his well-being. And he's very fortunate. I'm not sure why he hasn't tripped into type 2 diabetes, but he doesn't seem to have. So that's a good sign.
There are always going to be other things that might influence you personally as well. So it may not be gluten or dairy, but those are really good places to start because there's so much of the population that are influenced by gluten and dairy.
Well, and the other thing, if we take those both out, then a lot of our pre-processed foods or heavily processed foods disappear.
Exactly.
Because you can't get them without. You can, I mean, if you lean huge into the corn world or into
Yep.
the rice world or into the, I guess, soy world, then you can do it. But anytime are heavily processed, and flour is a great example, because a slice of bread, white bread, or even brown bread, unfortunately, it's a pulverized grain. So that's a huge surface area, hits the body when it gets digested, and those simple starches become huge spikes of glucose. In fact, a slice of bread is, I don't know how many teaspoons of equivalent to sugar, something like 4 or 5 teaspoons of sugar, because it does the same insulin spike, inflammation spike, and the downward trend.
Mm-hmm.
And the other interesting thing about the body is when it gets those carbohydrates quick and easy, it's developed a principle. When I'm getting them quick and easy, and the time would be in the hunter-gatherer society when we're all living out and now we've got all this fruit, and the body does what it thinks it needs to. It stores that quick and easy high source of carbohydrates, stores them in fat for the long, lean winter. Well, happily, the majority of us don't have that long, lean winter.
Mm-hmm.
We might have the long winter, and certainly in parts of Canada we do, but we don't go through that time of semi-near starvation and live off those fat stores. So the body's been hoodwinked, changed.
Mm-hmm.
In fact, they call it the thrifty gene, don't they?
Mm-hmm.
The thrifty gene meaning you've got the genetics, and this is all through Asia, so it affects very much our First Nations people. It's through components of Africa, so it's in African Americans, and it's certainly in the majority of people around the world. But they can have a very dominant thrifty gene, and that means they make fat really easy because they really need it, so they can be thrifty for next time when they don't have food.
Mm-hmm. And speaking of energy extraction, your microbiome influences your ability to extract energy from different foods as well. So the more you train your gut microbiome to extract energy from something like fast food at McDonald's or A&W, that's what you're set up for. And so if you are constantly eating those things, your microbiome is trained to extract the energy from those things, and you are more likely to be obese if you are eating those things. Whereas someone who has trained their microbiome to extract energy from fiber-rich foods, if they were to go to McDonald's, they're not going to extract as much energy from those things.
Yeah, I mean, it's probably 15 years, maybe 20 now, since we had the movie Super Size Me, where a guy, saw his doctor, planned to eat heavily. Did he eat 3 times a day at McDonald's? Anyway, I mean, I'm not trying to promote one company or the other, but when you do fast food, fast food is a very dominant thing, especially in the United States, but we follow along pretty closely in Canada. But the fast food is partly a function of the subsidization of soy and corn and these entities within the food system, and so that you can end up often paying less for fast food than you would think would be normal. Consequently, people go there, and it's an energy leakage too. Mm-hmm. I'm not sure how they're doing in today's. I know you can't eat in at them, but I'm sure they do takeout.
Yeah. So
some of us have moved on. I mean, I can only applaud people out there because I know for a fact people are cooking more things at home. It's outstanding. I get that. I mean, they've got more time, energy for food prep. So what we'd encourage you've already learned a lot of good things, I suspect. So now it's time to treat yourself, because some of us are starting to shift back toward normal. I'm not quite sure how soon we're all going to be normal. It's all going to vary where you are in the world. But I'm optimistic. But let's take these few remaining days or few remaining weeks when we're at home, we've got more time in our hands. Let's start focusing on our health recovery, because that could give us resilience. I mean, my best impression is within a year, 80 to 90% of us will be exposed to COVID-19. Mm-hmm. So it's a little bit academic whether you get a vaccine or not, because most of us will have it already. I think there's 60 or 90 more labs working on measurement of antibodies. The FDA has approved some already. And once we have an antibody testing, then we'll know. But in the interim, you need to improve your best options for yourself. Vitamin D is a bit of an important one to talk about today. Vitamin D, so remember, if you're under 40 and older than 1 year, 2,000 international units of vitamin D3 a day. If you're over 40, at least 4,000 units a day. I take typically 7, but I've got some malabsorption, probably almost like a celiac type syndrome. Okay, so vitamin D helps insulin response. It reduces insulin resistance, which is primarily what type 2 diabetes is. At the same time, vitamin D is a fat-soluble vitamin. If you have a lot of excess adipose tissue, you have more vitamin D receptors, and you probably will need a higher intake of vitamin D than the norm. So that's why measuring it once or twice a year until you figure out what normal is for you. And I take a supplement year round. Yes, I do get 4 months of sunshine per year, but because I'm older, I don't make vitamin D as good on my skin. And then you couple with that the people that slather on a lot of skin protection with their sunblock, all of a sudden they're making 1% or less of their vitamin D. So ideally you would get 15-20 minutes exposure of good quality sunshine per day. And where I live in Canada, about the 49th parallel, I can do that from about now till September, 4 months. In fact, we had some sun the other day, 2 days ago, 27, 28 degrees here. All of a sudden, I'm tanning. It's all good.
Right.
So I think if we take the vitamin D piece and extend that to what other things should you be doing. So you really need to reduce those simple carbs. And you find the diet that works for you. The other thing that I've had great success with people, if they will do the gluten-free, especially, and also the dairy-free, and they will aim for 3 to 4 days a week where they do 13 to 15 hours fast. So eating early in the evening, going through the night with nothing but water or tea, or coffee, I suppose, without milk, then all of a sudden the body gets triggered into and it starts to burn some of its fat stores.
Yeah, you could even extend that and do a longer one. So there is data to show that doing like a 5-day, even fasting mimicking diet where you just end up reducing your calories for that 5 days, and you were to do that every 3 months, that can be really helpful as well for stabilizing insulin and reducing obesity.
Yeah, so that's one of the ones that's touted for longevity as well, right?
Exactly.
Because there seems to be a sparing. So there was a day we thought about reduced intake of food would make you live longer, and that may be true, but it's a little bit of a bumpy road to walk depending how thin you are. But so the 5 days every 3 months, that doesn't sound too dramatic.
No.
And how low do you need to get your calories if you're ordinarily eating, say, 2,000?
I think it's actually about 500 calories.
Yeah, 500 calories, which isn't a lot. But most of you will have noticed, or maybe you haven't done it yet, but if you do take that fasting time, so that means there's no nightcap of booze.
No.
There's no beer or wine before bed, because that's beating you out of the extended time. So if you're eating at 5 or 6 o'clock and then you're eating again at 7 or 8 o'clock, you got your 13 hours. And if you do that, I mean, I had one woman, she was in that toughest area, which is the premenopausal. So in the 2 or 3 years before and after menopause, it's a particularly tougher time for women. I think the body is starting to store it around the middle. They've often been very efficient for women because they needed that fat store to get through a healthy pregnancy. And things have changed over time, but the body's metabolism and concepts about having healthy babies hasn't changed.
Right. And speaking of that sensitivity from women, we don't necessarily recommend intermittent fasting every single day for women because you can end up triggering the stress response and going into stress mode, but doing the intermittent fasting intermittently.
Yeah, by the intermittent fasting, do you mean the 13 hours or this is more? This down to 500 calories?
The 13 hours, or sometimes they even recommend 16 hours.
Yeah, everybody's got a different favorite zone. I was kind of at that 14, 15 aiming for, and My friend says 13 seems to be optimal. So I think try and work out what works for you and what works for your timing and what you do. Some of you don't need breakfast. I don't function well in the morning without breakfast, and so I tend to have it earlier and then try to be good to myself. And so if one could do it 3 and maybe 4 times a week, that's it. That's enough for most of us to start to improve our insulin response and reduce our insulin resistance. So now we're getting a hold of and controlling our tendency towards type 2 diabetes, or maybe we already have it. So then if you're starting to improve those things, then you have to work with your clinician, physician, and maybe be tapering down your oral hypoglycemic drugs. The big favorite is metformin, but there's 2 or 3 others as well. And because you don't want to trigger a problem because you're having an improved insulin response, so consequently you may need less of those things that fire up the system. So it's a matter of working out that taper within your cells. I tend to do better with some healthy fats, whether that's, I'm huge on eggs. That's why I'm big on protein, because I'm doing 2 or 3 eggs a day, period. But I will use lard. I will use butter. If I guess I was high-end professional anti-casein, I would be using ghee. So we've got a new ghee recipe coming, so we might make that leap.
But you're not using any old butter. You're using organic grass-fed butter.
Organic grass-fed butter. That's right, because that works so much better. I still eat red meats, but they're virtually all grass-fed meats, whether it's lamb or beef. And we're very fortunate where we live in Vancouver Island. But most everybody in Canada, United States, and Australia, and even parts of Britain, they're much better at grass-fed beef than they were.
And perhaps this is a good lead into the short-chain fatty acids, because butter contains butyric acid, which is butyrate, one of your short-chain fatty acids, and this has a lot to do with your insulin sensitivity. So if you have tuned in for any of our microbiome talks or any of the talks with SIBO, you'll have heard us speak about butyrate and the other short-chain fatty acids a fair bit. And these compounds are things that your microbiota or your bacteria produce. They're end products of the bacteria fermenting and breaking down the microbiota accessible carbohydrates, so prebiotic fibers that you feed them. They turn those into things like butyrate. And butyrate is anti-inflammatory, it's immune modulating, it's like a currency for exchange between the gut and the rest of the body, and it also helps modulate your insulin sensitivity. And there are tons and tons of studies that have shown that the more you can increase these short-chain fatty acids, the more insulin sensitive a person becomes. And there are studies that have shown that people are actually able to reduce their medications by taking in more prebiotic fibers and increasing their production of butyrate and other short-chain fatty acids.
So butyrate, and so you've maybe already figured that out, but butyric acid, or butyrate, came from the word butter, because it's one of the dominant short-chain fatty acids within butter. So if we eat healthy butter, we're probably winning. So we're no longer in that fat phobia that we once were. We triggered that, I think, in the 90s, and everybody got bigger and bigger and bigger, because every time we replaced the fats in something, we put in all these other carbs, simple carbs often.
Yeah. I'd also love to just take a step back 1 second, because we were talking about finishing your meal earlier in the day if you were doing something like intermittent fasting, but that's good to do regardless. So if we think about the strength of your digestive organs, especially the pancreas, which is producing insulin, your pancreas is actually stronger earlier in the day, so it's going to secrete, it has more secretions earlier in the day. So if you can have your window of actually eating food, say from like 10 or 11 to 5 or 6 or maybe even 7 right now because it's light out so late, that's going to be more ideal for your digestive organs.
And I'm sure most of you have heard the principle: breakfast like a king, and lunch like a prince, and dinner or supper like a pauper. Because you want to be grading down, and I'm sure most of you have already learned that you're not going to do great by exercising late at night, because you're going to have problems with getting to sleep. Similarly, eating a huge meal at night and then not doing anything after it, is a semi-disaster for your digestion possibilities, but it's also a semi-disaster for parking it over into fat.
Mm-hmm.
So we've got some questions turning up.
Well, we answered the first question, which was about organic butter.
Okay.
We have a second question. What are your thoughts on CBD for pain?
Well, CBD, meaning cannabinoid, can be incredibly useful for pain. I mean, it's not accidentally that there's almost 50 pages on cannabis in my book, because chronic pain is from chronic inflammation. So anytime you dial that down, you're winning. So anytime you do these other steps to improve your obesity and diabetes, you're going to be reducing your pain. Cannabinoids function in that way because they downregulate inflammation in the body. And I've got a chart in my book which talks about all the possibilities of CBD and all the things it does. And one of them is reduce inflammation, one of them is to reduce pain, one of them is to reduce seizures, and the list goes on quite lengthy. So CBD is incredibly useful. It's not everything in pain relief, but some people it's very dramatic and it does really well for. I know it's easier to access. I think it's available now all through the United States. Well, I know it is because now they have a CBD only drug, Epidiolex, which is designed for a couple of rare seizure problems and works really well. So that's legal in the States, and most countries in Europe and certainly Canada, Australia, New Zealand also have one called Sativex, which is 50% CBD, virtually 50%. So the CBD is anti-inflammatory and it does reduce pain receptors. It maybe isn't everything that you need, but it might be a great start if that's the one you've got accessible. Similarly, as you do these other pieces to improve your diet and improve your activity, all of a sudden you're also down regulating the inflammation.
Right.
Too much inflammation, one of the 4 things in inflammation is pain.
Mm-hmm. Let's see. Crystal says, I'm in Nova Scotia. Do we have a CBD product we would recommend for someone in Nova Scotia?
Well, anybody living in Canada is entitled to get a medical document from their doctor, and then they can order it from a licensed producer. And there's about 50 in Canada, and they only work through mail order. But the other thing that happens in Canada is we now have recreational cannabis or marijuana, and those now need to have a label on them as to how much CBD and how much THC. So if you're wanting pure CBD, you want at least 95% CBD in that product, because some of them will have a trace of THC. That's probably not going to be a crisis in most cases. But those have to be labeled now, and those should be legitimate labels. They just finished a study in Britain showing that a lot of their CBD didn't have much in it, but that isn't as regulated. Ours is regulated now, and they need to mention by optimal, proper lab testing what's in it.
Mm-hmm.
Yeah.
Let's see. What is the best topical for pain from chronic shingles if a person cannot do oral medication?
So my favorite for shingles is still emu oil, because if you can put it on acutely and you can put it on long term. Emu oil penetrates human skin really quite well. And in addition, it's its own anti-inflammatory component. It's useful to put on 1st and 2nd degree burns immediately, because the sooner it goes on, the less problem. Most of you grew up maybe putting butter on burns. It sounded terrible when the doctor talked about taking it all off. It probably wasn't as logical, but emu oil is incredibly useful as an anti-inflammatory and as shingles. And I do have some people will take a few capsules per day, tends to keep it calmed down. Shingles is a real problem. And just while we're talking about shingles, we've had chickenpox as a child, almost all of us, and certainly my age group, and it can live in the nerves your entire life. Not unlike herpes simplex, which is the cold sore virus. These linger in our system throughout our lifetime, but the better we get our health and our immune system, and now we're doing it for COVID-19, but it holds true for all viruses, including the virus herpes zoster, which is what shingles is. and chickenpox is, the body will deal with it because it's attuned to it. We have millions and millions of viruses within us. They're even part of our messaging system within us. And so to say that we're going to keep one out completely, it's optimistic.
Let's see. Jody, I got my oxygen concentrator yesterday. What is the flow I should use, and why does the purity level change when I change the flow level?
Well, it depends what it supplies. So I would guess it's going to go 0 to 5 liters because that's one of the more common ones out there. In which case, as you take it up slightly, it probably makes a small amount of difference as to how much pure oxygen is. But in the majority of cases, it's already producing 93 to 95% oxygen, and that will make a profound difference. I would suggest if you're going to use it during the day while you're sitting up for an hour, hopefully with a non-rebreathing mask, good fit on your face, and put it at the upper limit of 5 liters per minute, and sit with that for an hour twice a day, and you will start to get some benefit from that. I think I've mentioned before, 1 minute with a teenager with that good fitting mask on, 1 minute improves their brain function for 24 hours. And so similarly, if you do it for those 2 hours a day, and then at night, I would suggest you put on nasal specs and put it at 2, or if you can handle it, up to 3 liters per minute. And that will give you 26, 28% oxygen because you're 95%, but you're breathing in a lot of normal air at the same time. But that will be very useful for you at night because it'll improve the brain's oxygen availability at nighttime, which is really important, especially if you're struggling with MS, because I think you are.
Right. So that's it for questions for this minute. But something else that can trigger inflammation and subsequently trigger holding on to adipose tissue or fat would be LPS, and that's something else that we've covered pretty extensively. So LPS is a toxin generated by gram-negative bacteria. So again, you want to shift your microbiome to have less gram-negative bacteria and more gram-positive bacteria so that you don't have this release of LPS happening from your microbes, which we're always going to have some release of LPS, but the issue occurs when the LPS becomes systemic. So if you have leaky gut, or if you eat a lot of high-fat meals, then that LPS attaches onto the fat, or it just travels through the leaky gut, enters into systemic circulation, drives inflammation, drives brain fog, and subsequently obesity.
Yeah, so there was a lot covered there, Kristina, and it was well covered, but we should break it down because it is so important. So the gram-negative bacteria, when the walls break down, they're kind of a double layer cell. That's part of what they get stained and called gram-negative bacteria. But we still have a lot of them that are valuable to us in the microbiome, and they will continue to die and turn over. I mean, bacteria don't live forever. However, what we want to have is a really intact gut lining. And the gut lining is, of course, our epithelial cells within the gut, and then they team up with a lot of commensals or cooperative bacteria to make a mucin surface and a relatively closed tight junctions. Tight junctions are those little, almost little cement pieces between the cells, but if they're unhealthy or they're aggravated, so they weaken if you take ibuprofen, a non-steroidal anti-inflammatory drug. They weaken if you take a large fat meal, okay? So you better be getting it really healthy before you take that large fat meal, or you're going to struggle. And the way some of us notice the struggle is we get clouded thinking or fuzzy thinking. That's probably means LPS has been released with what food you've eaten, and some of it's gone into your circulation. It's known to be now one of the triggers for MS. And certainly in an animal model, it is the trigger of MS, for example. It aggravates and weakens the blood-brain barrier, which again is the blood vessel lining within the brain. So the endothelium is throughout the body, and so that's why LPS release from a leaky gut will speed your atherosclerosis, and that will speed the downside side effects from your diabetes, type 1 or 2. And so each of those tied together, we need to get those as healthy as possible. So I think the short chain fatty acids are a piece of that. Having foods that we're not sensitive to. And I think, we don't need to beat around the bush. If you have a leaky gut, and that's been ongoing, it's now really limiting how many foods. I mean, I talk to some people, they're down to 5 or 7 foods a week. That's a far cry from the 40 to 50 we're trying to suggest, right?
Exactly.
So they look at us funny. So how can we help those people? We need to help them solve their leaky gut. And some of them, as a jumpstart speed technique, if they've tried all the other pieces of many foods and fermented foods and probiotics and prebiotics, if those aren't working, then it's time to go, I think, to gut floral transplant. And I'm still the biggest fan, I think, of the rectal implant of a healthy microbiome replacement.
Yeah, that's really great ending point.
Well, and I mean, yes, we are very proud to have those available where we are in Canada. We get, I think, the healthiest ones in the world. They come from TML Labs in the UK. They still have some on hand because everybody's having a COVID shutdown, of course, everywhere on the planet. But those are the pieces that some of us will need to use. And the day is coming. They've already tried a number of studies to see, will this help reverse diabetes, type 2? Will it help reverse obesity? So the studies they've done with oral capsules tend not to have worked. That doesn't surprise me too much because it's really hard in oral capsules to get the large amount. It can be risky too. There's been a couple of deaths where people have died because if you take in 20 or 30 capsules and then you're unlucky enough to vomit them up because you don't feel very good, all of a sudden they go into your lungs and that's where the death occurs. Much more physiologic because the dominant piece of our huge part of our microbiome, yes, it's right from the mouth on down, but is in the large intestine or colon. And that's where it's more optimal to put them in after a day or two or more of colonics to clean things out, and then having that new zone area. And we even teamed this up a bit the other day because people asked a good question, well, how can I get my SIBO under control? If you try all the things that, and you can do that in consultation with Kristina or Cindy, who work for us as therapists. In that consultation, if you're troubled also by SIBO, then you can probably figure out a SIBO correction path, and you might treat it and then go soon onto gut floral transplant. Because SIBO is also a group of certain pathogens are overrepresented in the small bowel. Hence the small bowel infection overgrowth. That's what it stands for.
And SIBO is also associated with obesity. They kind of go, they're self-perpetuating.
Yeah, it's a double vicious cycle.
Yeah.
And that's why I think the day will come when we know the optimal way to treat it, and gut floral transplant will be one of those choices. Because we've studied a lot of obesity people. They tend to have a different set of flora in their gut.
Exactly.
And once those are established, it's really hard to change them. It's very interesting what those can do because they can make the body super efficient. And that's why all of a sudden you reduce your calories, you can almost gain weight on increased calories because those bacteria make you super efficient at using the food that you do take in.
There is one theory. So with the methane dominant SIBO, one of the theories about the methanobacter is that it's there from these times of famine. So it's actually there trying to help you extract more calories from things.
Sure. And I mean, it's a very team approach. Don't forget, those bacteria communicate with one another. The fungi communicate with each other. The viruses are a communication method within our microbiome and within our own body and brain. And so all of those are working in conjunction. If we pass away or die, our bacteria don't do so good. Needless to say, we're part of a team together. So they try to make us super efficient. They make us help cope with famine. They make us help cope with other stresses. but we need to sometimes help them adapt back toward normal if we're having a downside, which is might be obesity, it might be type 2 diabetes, might be SIBO, all across the board. Resetting that balance, that's the key thing that we want to get back to that homeostasis, so-called.
And it takes about 6 weeks to start making surface level changes to your microbiome, and it can take years to make base level changes. So be patient with yourself because it does take time.
Yeah, for sure. So we've had one of our other people, Crystal, has mentioned that she has MS and CCSVI. We've talked about that in a previous time, the CCSVI. What I alluded to earlier in use of oxygen, I think oxygen at night, that's what I do. When I'm traveling, I always have my little oxygen concentrator set at 2.5, 3 liters per minute, and I use that with nasal specs throughout the night. Of course, if you're going to get up at night, go to the bathroom in the dark, please remember to take your nasal prongs off, or you get a big jerk back on your neck, or the alarm goes off, which upsets your partner.
Yeah. Well, I'd love to give you some nutritional homework for increasing your insulin sensitivity and improving your short chain fatty acid production. So number 1, for breakfast in the morning, if you eat cereal, try exchanging your cereal for something like oatmeal with ground flax. And all of these food suggestions I'm giving you are low glycemic as well. You can exchange your gluten-containing pasta for something like konjac pasta. So this is like a newer pasta that I've seen in the grocery stores and health food stores now, and it actually comes from a root, and it's called konjac.
Is it more common in the Oriental stores? Or not really?
No, I've been seeing it almost everywhere now.
Okay.
Yeah, I think it's even in Superstore.
KONJAC. Okay, thank you. Yeah.
I'd love to see you guys trying out things like brown seaweed and okra if you can, because these are things that are known to decrease our LPS circulation and increase our short chain fatty acid production. And same thing with cinnamon. So if you can incorporate cinnamon, say, into the oatmeal or other beverages that you're drinking, that can be helpful as well.
We had some okra the other night. It was extremely good. It was Indian food, and we haven't grown it before. I think we planted it again this year. Okra has a kind of a different texture to us. It almost feels like a jelly or a goo. So let's think about that for a minute. Maybe the okra is helping seal that gut lining by putting that layer over top.
Exactly.
It may or may not be the case, but as long as I can picture it working, it helps. But it also seems to have prebiotic type components which seem to work well with our friendly bacteria.
Exactly. And there are certain microbes that like to feed on mucilaginous foods. So Akkermansia muciniphila, which is notoriously associated with leanness. So I have a lot of clients who call into our office and they're like, well, can you guarantee that we get Akkermansia muciniphila in your gut flora transplants? And it's like, well, no, I can't guarantee that. But I can tell you what to do to help you try and feed it so that it sticks around from some of those implants. And so Akkermansia is one of the ones that likes mucilaginous foods, among other things.
Yeah, and that's why when my wife and I started to look for therapists to work within our transplant clinic, we look for people with lots of nutrition training, because we know if you're going to have success with your gut floral transplant, you really want to be getting the nutrition optimized as well. It's like any part of health. You've got to look after the whole piece of journey. We're well past that one pill for one ill or one problem and recovery. It isn't near that simple, but you've all learned that now as we've talked about the different steps to optimize your immune system for COVID-19, and also on how now you can start to work on the basic problems which are going to give you a longer, healthier life and a longer, better functioning brain.
Sandra is asking, is HbA1c the best indicator for diabetes risk?
Well, it probably is. It's the most commonly used one. So that's hemoglobin A1c. So they take a component of the hemoglobin red blood cell, and so they get a 3-month measurement of what your glucose is doing, kind of on an average. So a fasting blood sugar is exquisitely useful for certain things, but better for the 3 month is the average of the hemoglobin A1c. There is some other subtleties that some people will go to, and that will be to see what your fasting insulin is, because those are all stress markers components. But the most understood one and used one is hemoglobin A1C. In fact, it's 40 years ago, I was in general practice. I had a couple of clients or patients, and they would delight in eating, a big piece of pie in front of me when we'd gone fishing together, because they had learned if they were really good for a couple of days before they came in for their fasting sugar, they didn't do too badly. But hemoglobin A1C blew that right out the window, because it's a 3-month average. You can't fix it in a day or two. Yeah.
Okay.
So it's as good a measurement as any to follow with. Are we creeping up to the hour?
We've got 10 minutes.
Yeah, okay. Yeah. So, CBD in French. I'm not sure. It's a good question. There's a fellow in France, in Paris, who's just at the last pieces of putting my book into French. We're just getting it printed into Spanish, and I can't give you a good answer what CBD is in French right at the moment. But I will put that on the website, or we'll try mention it next time. Our plan is on Thursday to kind of do a summary of the COVID talks, because as of next week, we'll probably go to 4 in the afternoon, 1 day a week, because everybody's starting to mobilize, depending where you are, getting a little bit back toward normal. And then as we follow along, we will then be doing roughly a chapter of the book per week. Probably ended up being 2 weeks on cannabis, because it's the longest chapter in the book. But most chapters are 10, 12 pages, and we'll, work our way through the book to a great degree. So if you want to get it, you can certainly get it in an audio form at drbillcode.com. You can get it in Kindle, Kobo, Nook, and Apple Book, all those forms, through Amazon or other focus sites. And it's available now, will be available in Spanish shortly. And we'll put it in Spanish into some of those formats. And then the same with German. That's been translated into German, or the Solving the Brain Puzzle book, and can work into that. So a focus place that you can look for that, or for these talks. The other thing we're going to do with these video podcasts that we've been doing on Facebook, and I've been doing with my colleagues at Point of Return, is they're also on my website, drbillcode.com, and we're going to put them in an audio format, which was wisely suggested by a friend of my daughter's. And it's a good idea, because some people like to carry around with them, listen to it during the day from their phone, I guess, when they're working. And now that we're going to have our phone with us all the time, so people know where we are, all those interesting things. We'll see how that works.
Yeah. Did we want to give a mention to the oral microbiome diabetes connection?
For sure. Well, why don't you start it off?
Okay, so we've mentioned before, actually, in the first couple talks where we were talking about the coronavirus and microbiome connection, one of the strongest links was actually between the oral microbiome and the risk factors that predispose us to coronavirus, and those risk factors being things like diabetes and cardiovascular disease. So we see that those with a dysbiotic oral microbiome, or those with periodontitis, these are the people who are more likely to have something like diabetes, cardiovascular disease, and then be more susceptible to coronavirus. And so we've put out a lot of suggestions already for helping create a balanced oral microbiome. And actually, Cindy, one of our other therapists, brought in Dr. Kiratola's toothpaste today, his homemade recipe. So we got to try his homemade toothpaste and the homemade mouthwash as well. And so one of the tenets to the creation of these products is that they are not overly antimicrobial. So we actually don't want to overkill the microbes in our oral microbiome. We actually want to help them flourish. And so you actually want to avoid oral products like Listerine or anything that contains triclosan or alcohols, because those are things that are actually going to wipe out your oral microbiome. Instead, we want to take things that help it grow in a healthy way.
And we can take that a little bit further. A lot of our dental colleagues have been very keen on xylitol, Dr. Curatola is not, and I've taken, his perspective. We also know that xylitol is a problem in digestion. It can irritate and flare SIBO, for example. So xylitol is not really your friend. So those of you who've gone onto xylitol gum, keep looking for something. If I was going to take a sweetener, then I would pick stevia over anything else, certainly in that regard. So we've had one other question from Sandra just with regard to the use of all this hand sanitizer. And as I've talked about before, antibacterial sanitizers are not worth a particle of help when it comes to avoiding viruses, okay? They're antibacterial. COVID-19 is a virus, not a bacteria. At the same time, one of the dominant pieces within those was triclosan, which may still be around in some of the hand sanitizer solutions. I think it's frightening that it's still in toothpaste. So most of your dominant ones on the market, will still have triclosan, which is the scorched earth policy. You don't want that, and we know triclosan is absorbed into the body and is an irritant problem for the brain. Most hand sanitizers that we're using now are high in alcohol, okay? They need to be 60% alcohol or more. As long as you can use a moisturizer sometime after, you're going to be okay. My favorite, big time, and everybody still says this, soap and water. So if you can do soap and water stations, liquid soap or whatever the variation there is, those are much better than the other possibilities.
Do you want me to shut that door?
Yeah, I'll get it.
So one of the other things that I love to do for the oral microbiome is use green tea. So actually what I'm going to do today, I'm going to take home the mouthwash that we have now that Cindy made. I'm going to add some green tea to it because green tea is shown to reduce some of the pathogenic behaving microbes that can occur in the mouth, some of the ones that drive cavities and infections, and help boost the populations of the beneficial microbes in the oral microbiome.
And, just to reiterate it again, so the oral microbiome is your nose, sinuses, and mouth, okay? Right back to the throat, okay? Each of those areas have their own relative mini microbiome, mini environment, you might say it. And each of them wants to have its own healthy group of bacteria, viruses, and so on. And if those are in better shape and healthier, so the thing you could do instantly in 3 or 4 days, you could greatly improve your mouth microbiome. And that is where COVID-19 almost always enters first. So the better shape it's in, with all its friendly cooperative bacteria and fungi, the better things are going to be. And that's why maybe one reason why they're putting dentists back on stream pretty early in parts of Canada, and I expect the US, because a healthy mouth and a healthy microbiome is really important. And tooth disease, gum disease, all of those problems are a huge increase in your cardiovascular risk factors, your diabetes risk factors, and even probably your obesity risk factors. So again, of course, minimize those antibiotics, especially minimize that glyphosate. You've heard me harp on this drum before. I think glyphosate, which has been a huge increase since 1994 and goes up all the time, is probably one of the reasons our microbiome's so messed up, aggravating all of obesity. It's time we got out and said it, but I think it's an extra nail in the coffin, speeding up the problems of obesity and diabetes.
Right. Yeah. Well, that takes us to 1:58. So should we?
So we've had a question about the mouthwash. So I think we will make our own variation of it. Well, we'll credit Dr. Curatola. So we will put his mouthwash on it and mention his book, and credit him for it because they've developed it. As well as his over-the-counter purchasing toothpaste, Revitin. So we'll mention those on my website, drbillcode.com, and then you can find it. I'm not as good at posting things onto Facebook, but you can do a quick link to the website.
Yeah, I'll make sure that we get it to you, Shelley.
So you can find that under blog on the website, of course. Maybe that's not intuitively obvious. It is for all you younger people, I get that. I'm still adapting. Blog means podcast, not just written stuff.
Yeah.
Okay. Well, thanks very much. So on Thursday, if you send any questions in, we can lean toward them. We did have a good question from Bruce the other day on covering issues of gastritis, H. pylori, and I'll call it heartburn. I think I'm missing the third one, but we will try and cover that concept on Thursday. And so send in other things that you haven't quite understood or want more detail on today or some of the previous podcasts, because it's kind of a wind-up summary of a lot of the things on COVID-19, and if there's any brand new outcomes, we'll talk about those too. So look forward to that, and our meeting time next Tuesday will probably be 4 o'clock Pacific Daylight Time on Tuesday. So 1 week today, and then we'll be going to 1 a week.
Okay, thanks for listening, everyone. We will see you on Thursday.
Have a great week, and stay well.